Madam President, I wasn't even planning this today, but I was at, as many of my colleagues do, I do a morning coffee where anybody from my state of Ohio, as I know Senator Durbin does in Illinois and Senator Udall in New Mexico and others, that, and my colleague in Ohio does one too, Senator Portman, that people can come in from around the state and talk about what they want. And a couple came in today, a couple of a father and a mother and two children. One looked to be maybe 10 and the other looked to be maybe 15. Came and wanted to talk to me about their private school. They have a sort of a homeschool association, it sounded like, from, conservative part of Ohio and Southwest Ohio. And we talked about what we could do to help them in terms of educating their children. And then right before we parted, and I was going to see other people at this coffee, we had maybe, 75 people there. And the mother of these two children said, "By the way, thank you for the Affordable Care Act." I said, "How's that?" And she pointed to her son. She said, "My son," I think he was 15. She said, "My son is diabetic. And as I learned later, was diagnosed at the age of 6 and has injected insulin into his arm and his leg for, 8 or 9 years." She said, "My son, who is diabetic, we couldn't get insurance because of my son's pre-existing condition, diabetes." And I said, "Yeah." And she said, "We were turned down." I counted them, she said. "We were turned down 34 times for insurance. My family was turned down 34 times for insurance. And because of the Affordable Care Act," she smiled and she said, "we now have health insurance." And that's not the first time. It's one of the most poignant stories I've heard in the importance of this new law. There are 160,000 people in my state that now have insurance that didn't have it in December. But this family, you think about what this is all about. I mean, this family's peace of mind, this family's ability to focus on other things now because they have insurance that they couldn't get, even though he had a job, the father had a job. I'm not sure where the mother worked, but the point is they were turned down, she said, 34 times because their son cost the insurance company more money because he had a pre-existing condition with diabetes. So I guess my question to my colleagues is, why do we want to repeal this? How do my colleagues, including many, many elected officials in my state who have been very resistant to the Affordable Care Act, to win elections saying, "I'm going to repeal the Affordable Care Act," how do they explain to this family? Were they going to walk up to this? They met this family, she said, and the mother said, "We have insurance now. We were turned down 34 times. Why do you want to repeal this law? Why do you want to take it away from the 160,000 Ohioans that have insurance? Why do you want the 100,000, 25 and 22 and 19-year-olds in Ohio, my state alone, one state of the 50, 100,000 young people have insurance. They're on their parents' plan because of the Affordable Care Act. 900,000 Ohio seniors have gotten checkups, no copay, no deductibles, free checkups, free osteoporosis screening, free physicals because of the Affordable Care Act. How do you take that away from those seniors? How do you take away the $900 in savings that the average senior in my state who's on the President Bush initially drug plan, Medicare drug plan? How do you take that $900 savings? You're going to repeal Obamacare, you're going to repeal the Affordable Care Act and take these away? How do you face these people like the family I met today? 34 times she was turned down for insurance. I didn't make this up, that's her number. She said, "I counted 34 times they turned our family down for insurance because my child has diabetes." How do you think that makes him feel, first of all? But equally importantly, she has the comfort and the safety in her mind now of having insurance. And I don't even understand. What do my colleagues do? They wake up every morning thinking, "I want to take that insurance from 150,000 Ohio families. I don't want them to have it. I want to take those benefits from those 900,000 Ohio seniors. I want to make them pay $900 more." That's what they're saying. Repeal Obamacare, we lose all that. And that they want to keep talking about taking these benefits away. Let's live with this law. Let's make it work well. It's starting to work really well in Ohio. We're having thousands of signups every single day. I know the presiding officer state of Hawaii, they're getting lots of people to sign up. Lots of young people are signing up. And let's move on. Let's stop debating this. Help make it work better. And let's talk about how we create jobs, not how you're going to repeal some health care law that you didn't like because it didn't fit with your ideology or you didn't like the president or whatever the reasons my colleagues seem to not like the Affordable Care Act. I mean, history is going to say over and over, why do you want to take these benefits away? This is working. You remember back with Medicare in 1965, the Tea Party, they were called the John Birch Society then. They didn't like it. Insurance companies didn't like it. The AMA didn't like it, but everybody liked it 5 years later. Social Security, the same forces, the same far-right forces opposed creation of Social Security. 5 years later, people liked it. This stuff works, and it's going to make such a difference in people's lives. And, forget about the 150,000. Forget about the numbers. Focus on that family. 34 times turned down for insurance. She's got insurance now. Her diabetic son can get the care he needs. That's such a wonderful thing. Madam President, I suggest the absence of quorum.